everybody, and welcome to the Bethel Park Live Well Speaker Series. Tonight, I have the pleasure of introducing Dr. Emily Gleason. She's a MD at St. Clair Family Medical Practice at St. Clair Hospital, specializing in family medicine. Dr. Gleason is here tonight to talk to us about weight loss and the obesity crisis. Dr. Gleason, welcome.
Thank you. All right, so I'll get started. So the presentation I put together here is called Weight Loss, a Beginner's Guide. And just, you know, a little bit why I put that in quotes is because most of you will probably say that you're not a beginner at weight loss and you've probably tried before. So, you know, most people are old veterans. So we're going to get into some ways to work on this, okay? So things that we'll cover, so we'll go over the background of obesity and being in weight loss. And, you know, I put here in all capitals, losing weight is hard, because that's something that we will definitely hit on. And it's something I really want to emphasize. And some ways to lose weight. So we'll touch on diet, exercise, medications, and surgery. Okay. And then of course, questions at the end, if anyone has a question. So what is overweight and obese? So some definitions here, BMI, which you guys probably have seen before. It stands for body mass index. So it's a measure of how much body fat for height that you have. So BMI of 25 to 29.5 is considered overweight. And then anything over 29.9 is considered obese. So here's the lovely BMI chart that people have probably seen before and probably have a little bit of a unfriendly relationship with at times, but you know, no one likes to be categorized into overweight or obese. You just kind of think of yourself as who you are, but it's very helpful as far as risk stratification and kind of tracking and knowing when to start different mechanisms for weight loss. So it's good to know where you are on this too, because, you know, I think that having the knowledge is powerful. So just a note about BMI, it does have some pitfalls. It doesn't work for everyone. It does not distinguish very well muscle weight and fat weight. And particularly in, you know, someone who's maybe a bodybuilder may come up with a BMI that is considered obese or overweight. And then on the other side, there's some people who have a normal BMI and actually have a significant amount of body fat, so would maybe be more at risk. And then, you know, sometimes considering older folks, like those over 65, a higher BMI, like the range of 23 to 30, might be healthier for them. So then the other thing is the distribution of fat. So it's important to consider, you know, where the fat is. Is it in the midsection, kind of signifying that there might be some fat on the organs, or is it more in the lower body, which is typically associated with a lower risk? So that's important to consider as well. So why do we want to talk about this? So obesity is really on the rise, as you guys know. It affects at least 100 million Americans, which is about 68% of the adult population. And people want to talk about it. It consumes a large number of office visits every year, whether that's to your PCP or endocrinologist, cardiologist, et cetera. It's being talked about. There are genetic factors, environmental factors, and behavioral factors that go along with obesity. And of course, we can't change our genes. So, you know, we don't want to focus on that too much, but we can work on our environment and our behaviors. So there's, again, some power there. The other thing here that I put in bold is stigma, because there is a huge obesity stigma. As people, you may know, there's in medicine, there's a stigma, and in society. So that's important. Obesity is associated with a shortened lifespan and associated with some diseases such as type 2 diabetes, heart disease, some cancers, sleep apnea, liver disease. And losing weight, even as you'll see, just a small percentage decreases all of these risks. So here's a little chart that it's busy. You don't have to really take too much out of it, except that I wanted to note that the percentage of people who are overweight, so this blue line in this red line, so men and women, that's stayed relatively stable from the 60s until present time. But obesity, the number of people in that category has really gone up. So that's kind of when we talk about this obesity pandemic or epidemic that's going on, that's what we're talking about. So motivations for weight loss, it's really going to be different for everyone. And if we could talk in person right now, I'd try to see what everybody's motivations might be. But some that I hear a lot, some people just say they want to have better overall health. They want to live longer. They want to have less pain, take fewer meds, have better mood and energy, go to the doctor less, which I won't take personally. I get it. They want to have better confidence and they want to look better, which there's no shame in that. So one interesting thing is there's often more women coming in for weight loss than men because of this cosmetic desire. And it's actually, there's sometimes a little disconnect because for health to improve, you really only need to cut back 5 to 10% of your weight loss, of your weight. But for a cosmetic effect, most people want more of an outcome, so they can end up getting discouraged. So losing weight is hard. Back to that, it is very hard. And I want to just underscore that because you've probably tried, you've probably been discouraged, and I don't want you to think that your medical professionals think it's easy, because we know it's not. The stigma plays a big role. So even just looking at how the FDA approves medications is a stigma, because they say obesity is a cosmetic issue, not a medical one, which just isn't true. So medications may be held to a higher standard before they're approved for weight loss. Then there's not good reimbursement, so there's not as many weight loss drugs being made. And it's important to note that when your BMI hits 40, it's really difficult to lose weight, successfully without surgery, which sometimes that's not talked about much. Then, you probably have noticed the plateau, so maybe you cut your calories for 3 to 6 months and then your body starts to compensate and try to keep you at that set point, that wants to keep you where you are. So that makes it very challenging. And then genetics play a huge role. So that can be working for you or working against you. So some things you can control, there's definitely a lot that you can. So your mindset, it's important to remember that this is not a short-term thing. This is a long run goal. You're not going to get quick results. So trying to get your head in it for the long run. And it doesn't have to be all or nothing. So, some people say, well, if I can't have dessert once a week, I'm not doing it. Or if I'm only going to lose 10 pounds, I'm not going to do it, whatever. So trying to lose that mindset, get some support. That's really important. Family, friends, doctor, therapist, nutritionist, whoever it is, it's important to have someone in your corner. And then trying to remember that exercise doesn't conquer all. So you might start a new exercise regimen and say, well, now I can go out to eat every night and eat whatever I want because I'm exercising. Unfortunately, a good brisk walk only burns about 100 calories per mile. So it's tough sometimes to counteract with exercise. And sleep. I'm giving you a prescription for sleep because it's very important to get about 6 to 8 hours a night to reduce your risk. But with that said, if you're going to wake up an hour early to exercise, that has actually been shown to be protective. So you can still get up. I won't say you can't do that. So into the ways to lose weight. So here's a list. So the intensive lifestyle interventions. These are often used in research. We don't have, as far as I know, a big intensive intervention clinic here. I wish we did, because it's a full service, sort of combines calorie reduction, physical activity programs, coaching, guidance. It combines everything and really gives you what you need to lose weight. Hopefully that will be the future. Then there are diets. You've heard of a number of them probably. There's like Whole30 and keto. Those are some of the ones I've been hearing recently. Weight loss programs like Weight Watchers, exercise, of course, medications, and surgery. Now, it's important to note that most people will take some combination of the above. It's usually not going to be just one. So whichever route you take, again, don't do it alone. Get someone working with you. It's going to be much, much better if you have someone that you're accountable to or someone who's helping you out. So let's start by talking about diets and weight loss programs, kind of combining the two together. So as far as changing how you eat, it's going to always be important to know that calories in has to be less than calories out. You can't really do any sort of effective weight loss without reducing calories from where you are now. So some people will like to count them. Some people don't want to do that. That's too obsessive. Everybody's different. And there's no one size fits all diet. You don't have to say, well, this diet's probably better than that one. It worked for my friend. Maybe it'll work for me. It's honestly, the secret is you just have to pick one and stick with it, because that's the most important thing, is being able to adhere. So pick something that doesn't make you miserable. Most people can lose weight with any diet. That's really the truth. Working with a nutritionist or a therapist, I always recommend, because you may realize you don't really know how to eat. You don't know exactly what foods you need, or I don't. I'm learning all the time. So it's definitely good to work with someone who can help teach you about food. And then portion control is really important. So with that said, this is a portion control plate. You can actually get these, but I just like to use it as a little bit of an image to show you, fruits and vegetables should be about half of your plate, and then proteins and grains the other half. So I think we probably have a little bit less of the fruits and vegetables mostly in our diet. But the other thing to note is that we probably eat too much. So a lot of times you can make a lot of change just by cutting back your portions. So sometimes I would say decreasing exposure to problem foods is helpful. So someone who has a really big issue with chocolate or chips, try just taking that out of the house. Don't let yourself have it, because you'll have a weak moment. And if it's there, you'll go to it. This is important. Set reasonable goals. I think people sometimes try to start an exercise routine and say, I'm going to start off by running an hour a day. And that's just not going to happen if you're just starting out. You have to take it easy on yourself. Start out 5-10 minutes a day, even work your way up slowly. And same with calories, don't cut back so severely all at once, or don't expect yourself to lose a huge amount of weight in a month. Just, give yourself some leeway. Look at your thoughts, some cognitive distortions. If you think, oh, I ate dessert tonight, so I'm never going to lose that weight. Try to, turn that into problem solving. So, okay, I had dessert tonight, so I'm going to reduce my intake for my next meal, or I'm going to add a walk after dinner. There's always a way to problem solve. Then telephone and digital programs are popping up, and they're, especially right now during the pandemic, they're a really good way to, incorporate it into your busy life. So here are just some options that I found when doing a little search. Most of these are not free. They do have a monthly fee, but with it, you'll typically get access to a nutritionist or a counselor or a community that can support you. So just some options there. There are probably plenty more. So looking at exercise a little bit, exercise is an interesting one. We're not exactly sure from research how much the decreased exercise has contributed to the obesity crisis that we're in, but probably it does. Looking at jobs being more sedentary, people are doing more TV watching. Even you're not getting up to change the channel. You have a remote, or you have your cell phone. You don't have to get up to pick up the phone. Even little things like that have probably contributed. And looking at exercise for weight loss, aerobic exercise is going to make a bigger difference. So like running, jogging, walking, dancing, biking, things like that will be better than weightlifting. And the intensity really should be moderate to vigorous. And we'll talk a little bit more about what is moderate and vigorous as far as weight loss. So generally diet plays a greater role in weight loss, but exercise, needs to be considered for its important benefits for health and mental health. So, benefits for blood pressure, heart disease, and then mental health is huge. So the goal eventually, working your way up. So if you're going to do moderate intensity exercise, the goal would be about 150 minutes a week. So that's, if you think about it, like 30 minutes, 5 times a week. Or if you're going to be doing something more high intensity, 75 minutes a week. And again, don't start all at once because you're more likely to quit that way. So some moderate intensity activities, so brisk walking, water aerobics, ballroom dancing, gardening, doubles tennis, or biking if it's going to be less than 10 miles per hour. And some vigorous intensity activities would be hiking uphill or with a heavy backpack, running, swimming laps, aerobic dancing, so like Zumba, digging or hoeing in the yard for a long period of time, singles tennis, and jumping rope. And I think biking would be on this list too, if you're, like a spinner or someone that's doing that. So some ways just to get some more activity in your day. So maybe considering a standing desk if you're someone who has a desk job, taking the stairs, parking away from the building and walking further. Going for walks instead when you can do that instead of driving. Doing yard work, cleaning your house, go out and wash your car, rake your leaves, run up and down the stairs. If you haven't done any activity, go to the stairs. Maybe while you're watching TV, do sit-ups or squats, or download an exercise app if you aren't going to be able to leave the house. On that note, exercising during a pandemic is challenging. I've had lots of patients say they were in a really great routine until the pandemic hit because their gym closed, or they don't feel comfortable going to the gym, or it's cold outside, so they're just not going out. So some things you can do: look into a stationary bike or a treadmill. I know you can get used or reduced price on Facebook Marketplace or eBay. Look into an app. There's an endless number of apps, a lot of them free. And just suck it up and go outside. It's cold, but you'll get warm. Once you start moving, you warm up about 20 degrees. So if it's 20 degrees out, it'll feel more like 40 once you get moving. And then once it gets warmer, go golfing, walk the course, do tennis. We really think outdoor activities are pretty safe as far as the pandemic. And, just dance around your house with your kids or your grandkids. So again, it doesn't matter what you do. You just have to do it. As long as you like it, it doesn't matter. That's the most important thing, is that you like it, so you'll continue to do it. Typically, higher intensity exercise will make it hard to have a conversation while you're doing it. So that's a good kind of gauge. And make sure to check with your doctor if you're concerned at all about any of your health conditions before starting to work out. Okay, so on to medications. I think this is an area where people are a little more less versed and don't know as much about. So we'll spend some time here. It's not really new. There's been weight loss medications for a very long time. They're probably safer now. There was some safety issues back, in the 1900s, and so now it's much safer. Typically, we'll start medications in those who have a BMI over 30. Or over 27 if there's a weight-related illness like diabetes. So there's some meds you can be on long-term, and then there's one short-term med. So the short-term medication that is typically used is called phentermine, or Adipex, if you've heard of that. It's approved for use for less than 12 weeks, but there are certainly some people who are more versed in their use, like potentially endocrinologists, who will use it for a longer period of time. This medicine can cause some side effects like dry mouth, insomnia, nervousness, but they've seen the symptoms taper off as longer longer use. This medicine is typically not used in anyone with heart disease, high blood pressure, because it is in the category of a stimulant medication. So it's cheaper, on the cheaper side, and typically works by suppressing appetite. So some long-term medications. Orlistat is an older medicine that I've personally never used. I don't think people like it very much because it can cause flatulence, so not a super fun side effect. It does reduce the digestion of fat. And then liraglutide, which is also known as Saxenda or Victoza, is actually a diabetic injectable drug, not insulin, but an injectable. And the mechanism of weight loss is kind of unclear, but it was shown to cause some significant weight reduction in diabetics. So now it has been approved for weight loss. It's helpful for blood pressure, cholesterol, sleep apnea, and diabetes, of course. Side effects would be some lower blood sugars and GI side effects like diarrhea, people will report, or nausea. But rare, I would say. They're on the rare side. Now, that the problem with this, and really the next two medicines as well, is they tend to not be covered by insurance. So we're running into that problem here of obesity not really being seen as a disease that needs to be treated. I anticipate that will get better in the long run. Now, then there's phentermine and Topamax. So this is a lower dose of phentermine than previously discussed. So this is called Qsymia. This works by reducing appetite. And then the naltrexone Wellbutrin combination is also works by reducing appetite and food intake. So these two, they're also very expensive for most, but can be prescribed as separate medicines. So we get around that cost by prescribing the two medications separately. So I do use those relatively often. So some problems with medications: when the medication is stopped, you probably will gain the weight back. Only really expected a 5 to 10% weight loss, but again, that's enough to make a big difference in your health. They can be expensive, like we discussed, and at this point, not really covered by insurance mostly. So surgery, I'm doing this one last because it's the most invasive, obviously has the most risks, but I think it's something that should be considered sooner, especially in people who have a BMI over 40, because again, that's going to be the hardest to lose weight, and the benefits for your health will often outweigh the risks. So this is also something that can be an option in adolescents. So some types, there's the sleeve gastrectomy. You've probably started to hear about the sleeve. It has become the most common, and probably partially because it's considered safer than the Roux-en-Y, which is the gastric bypass that most people know of. And then there's the laparoscopic adjustable gastric band, which is, the lap band, people call that. And then this last one, the biliopancreatic diversion, it's not performed much by most surgeons because there's a high complication rate. So the sleeve is the most common right now. It has slightly worse outcome than gastric bypass, but it has a lower complication rate. Then the gastric bypass, which kind of it can get a bad name because people have all heard a horror story about the gastric bypass, but it's the greatest amount of weight loss, and very good results with it. So most of the time, actually very safe. It works by food bypassing most of the stomach. So gastric banding, lower complication rate, but less weight loss overall. So just some pictures to kind of show you. The first one here, picture A, is the lap band. So the band goes around the top of the stomach, and then there's an access port, and you can actually tighten this band as needed, and allow for less food to come in. And this one here is the sleeve. So it's basically cutting the stomach into a small tube here, like a sleeve, basically. And that allows less food to fit in at one time. And then the last one here, the Roux-en-Y, the gastric bypass, is basically it's a rearrangement of the intestines, so the food completely bypasses the stomach. So, let's see. So some outcomes with surgery. There is a wide range and variability in weight loss. So a lot of that is personal factors. And one study looked at the mortality rate and noted it to be 0.3% and a complication rate of 4.1%. So generally low. Definitely the experience of the surgeon is very important. So don't just go anywhere. Long-term complications. So some things are mild, like vitamin D deficiency, that can be kind of overcome with supplements. And then there's some more problematic things like intestinal obstruction or ulcer. And then, one of the things obviously is regain of weight. So most will need to be on lifelong vitamins and mineral supplementations. And the good thing is almost all of these, well, all of them can induce remission from diabetes, which would mean no more meds. So those who typically do best with surgery are those who weigh themselves frequently, avoid eating when full, and avoid snacking between meals. So some of that is pretty intuitive. And then anyone who undergoes surgery is going to have to continue their lifestyle modifications. So continue working on their diet, continue working on their exercise. So some benefits, just to name a few, is improved diabetes control or remission, improved blood pressure control. You might be able to stop your meds, improved cholesterol, hopefully stop your statin, improved sleep apnea, may not need to wear your CPAP. Reduced risk of heart disease and, reduced joint pain, reduced back pain, reduced heartburn, better sexual function, increased energy, increased self-esteem. So just to name a few, I'm sure everyone can come up with more. So some future research, places to focus and things I think we'll start to see more of will be personalized medicine based on genetics. So there'll be a lot more looking into, does your obesity come from, did it start even in utero based on what, potentially what your mom ate in utero, or if your mother was obese while she was pregnant, it could go back to even that. We'll hopefully find particular diets that work better for certain people's body chemistry. So more to come. And then I think there'll be a lot more focus on obesogens or endocrine disruptors. If you guys have heard anything about that, they're actually chemicals that are seen in a lot of the foods and in the supply chain. So like in plastics, for example, I think one that people have heard of a lot is BPA. Most of our plastic now is made without BPA, but that is one that was implicated as changing the way that our body metabolizes fat and stores fat, and potentially contributed to obesity. So probably more that we're still learning about. And this, I think, will help a lot to learn more. So takeaways here, obesity is a disease. It's not a choice that needs to be treated the same way as any other disease. And whether that's medication, surgery, diet, exercise, whatever it is, it has to be treated. And we have to break through the stigma. Like I just said, it's not a choice. It's not laziness. There's so many more factors. And weight loss is not something you should try to do alone. It's challenging. Accountability and support are really important. And there's no one correct way. You have to figure out what works for you. If you've tried and failed, don't give up. It can take plenty of tries to, be successful. So ask your doctor for help, your medical provider, whoever you see, ask them for help. And that's about it.
I have a couple questions. Touched on the one, you can't not exercise a bad diet, I guess. I always heard people, I cannot exercise this. That's definitely not true.
It's probably not true for somebody who's obese and trying to lose weight. I won't say it's not true for anyone. Let's say you've already, you're probably closer to a normal weight. What's that? Oh, am I?
You're good.
Oh, okay. Somebody who's probably a lower weight to start with can probably exercise so much that they can eat whatever they want. Someone who's probably has a lot of muscle mass already, and it's probably never going to be true for weight loss. It would be tough to exercise enough to overcome the calories that you could take in.
Is there one type of something in your food? Is it the fat? Is it the white sugar? Is it something that really pushes the weight to stay on and keep it on?
I think that is actually probably not one specific thing. It kind of depends. You know, if you're somebody who's a pre-diabetic, you're probably going to have a little more trouble with the white carbs, you know, sugar and white carbs, but it's probably the old moderation is key. You know, there's not one thing that you're necessarily doing. It's cutting back on all of the things that that your body doesn't necessarily need. So we don't necessarily need the white grains, the processed grains, the higher fat meats. But honestly, the calorie reduction will probably end up being more important than the actual food intake.
Okay. The way you're speaking about, there's some things, the way food was prepared and that, you know, changed our bodies, the way we metabolize stuff.
Mm-hmm.
I mean, I was talking to a doctor and he said, you know, in the United States, there's like 30 or 40 different ways, not wheat, but grains are done now. In Europe, there's 2 different strains.
Mm-hmm.
You know, he's like, that's a contributing factor to, you know, our unhealthiness. And I was like,
yeah.
Oh, well, you know, it's like, it's the way we manufacture stuff, you know?
Right. Yep. I think that will be a big, in the coming, hopefully soon years, something that gets kind of managed from more of a society level, that we address the way our food is produced and, you know, the way the food is available and what food is affordable. All of that can be problematic. It's hard to make a change when what's available to you on the shelf is things that taste good, but probably aren't great for you. So that'll be hopefully something that starts to get adopted more on a higher up level.
Speaking of muscle mass and body fat,
Mm-hmm.
as you're losing weight, of course, you got to do it through cardiovascular exercises, but shouldn't you be doing some type of strength training too? Because the muscle will help your metabolism raise.
Yeah, so, you know, even the cardio that you do is gonna actually do just as much for your muscles. So you don't actually have to be doing heavy weightlifting to build muscle. So the cardio is gonna help, you know, shred fat a little bit better, and it'll build up more lean muscle rather than the bulky muscle. There's weight resistance training is excellent as well. So if that's what you like to do, I wouldn't say don't do it, but you may not see as much of an effect on weight loss as the more cardio, the like running and biking and swimming. I will say incorporating the 2 is probably even better. So if you can do a little bit of resistance on top of your cardio, that would be probably even more effective.
Okay. And there's different ways to do weightlifting now. There's, you know, free weights, there's the machines, there's the bands that you have now that you just use your body weight with, which are, you know, great.
Yep.
Especially as you get older, you know.
Mm-hmm.
You know, when 20 years ago, you know, went at the free weights like there was no tomorrow. Now I'm getting older. I don't want to do it. I just want to maintain what I have.
Uh-huh.
So.
Yeah, I think body weight is you mentioned that, you know, great for building the core strength, this is kind of off topic, but I think doing body weight training, you know, working on the core is really helpful long-term for, you know, back pain and all the pain that goes along with gravity pulling your body down. If you can strengthen the core, that's really helpful.
Okay. What would you say one of the biggest mistakes someone does when they start a diet and exercise program?
I think honestly, probably expectations is the biggest. You know, it's like the New Year's resolution. Everyone thinks this is my time. I'm going to correct everything I've ever been doing wrong. I think people are too hard on themselves off the bat. And if you can sort of set some expectations and small goals to stick to, that's probably the way to do it. You know, everybody's different. Some people are the cold turkey type, got to cut everything out. But I find that most people end up giving up if they start with too high of a goal.
Understand. You mentioned all the different diet types, and there's a lot of over-the-counter, diet products out there. Are they actually, do they actually work? Are they bad for you as you take them? I mean, how do you know what is good for you and what is bad with everything is being pushed on TV and everywhere else,
Yeah, I would probably avoid most over-the-counter things, you know, supplements and any sort of diet pill. They're not regulated typically, and can be dangerous, especially, you know, there are some stimulants that you can get probably online and things like that, the quote diet pills. Those I would worry about with, you know, causing any sort of heart problem. So I think the safest way to do it, if you would like to take a medication, is to talk to your doctor. Usually we can figure out a way to get something approved by insurance and make it affordable. So I would probably, unless there's something I don't know about that's new and great, avoid the over-the-counters.
Okay. Well, I want to thank you for presenting tonight, Dr. Gleason. I've learned a lot. I hope our viewers have learned a lot too.
Absolutely. Happy to be here.
Well, thank you for being here.
Yep.
And Bethel Park, join us next month on the Bethel Park Live Well series. We have Bob Fergasco from Fergasco Financial Advisors talking about, can you afford to retire? So that's another important one coming up. That's another aspect of wellness.